Are you a breastfeeding mom who is struggling with nipple pain? Are you looking for tips on how to get relief? Then stick around because I'm going to share all the different things that can cause nipple pain and how to get relief. And spoiler alert, nipple pain is not always because of position and latch issues. Hi Mama, welcome to my channel, Breastfeeding Confidential, where I talk about all things breastfeeding. My name is Andrea Tran. I'm a registered nurse and a lactation consultant, an IBCLC, and I've been helping moms and babies breastfeed for over 26 years, and I want to help you too. If you're a breastfeeding mom and you want breastfeeding tips, information, and support, then I invite you to hit that subscribe button and that notification bell so that you don't miss out on any of my helpful videos. Today I'm going to talk about all the different things that can cause sore nipples in a breastfeeding mom and what to do about it. Nipple pain is a big problem with breastfeeding because it leads a lot of mamas to stop breastfeeding. It is one of the most common reasons that moms end their breastfeeding journey earlier than they had planned. Now you've probably heard that most nipple pain is caused by position and latch issues. And while position and latch is important, there are a whole lot of other things that can cause nipple pain in a breastfeeding mama. And the reason for your sore nipples is what will determine the best treatment. In the first few days of breastfeeding, most new moms do experience some nipple discomfort. Now, while good positioning and latch can help minimize this, the reality is that the majority of moms are going to have some discomfort. So let's talk about what's to be expected and what is beyond what is expected. Now, if you think that your positioning and latch technique is the cause of your nipple pain, then you'll definitely want to check out my video, How to Latch Your Baby So It Doesn't Hurt. Now, we have certain guidelines that help us figure out if a nipple pain that a mom is feeling is what we consider within normal limits or is beyond what is expected in those early days. Nipple pain that we consider typical or expected occurs within the first couple days. It usually peaks by day 2 to 4. It should be much better by the end of the first week and completely gone by the end of the second week. Bleeding, cracks, bruises, blisters, that's never normal. Any kind of trauma means that something is wrong. Your nipples should look round and be a normal color when the baby comes off. It should not be creased or misshapen like a lipstick or anything like that. So some things that can cause nipple pain that is beyond what is expected in the first few days: if a baby is tongue-tied, if a baby has a short tongue, if a baby is biting down or clamping when they're sucking, a baby with a high palate, or if you're improperly detaching the baby. It's very important when you're taking the baby off that you reach in and just gently put your finger in the corner of the baby's mouth and pull down to release that suction. Now, a couple things that can help with the discomfort in those early days. Gel pads have been a game changer for moms, and using some lanolin after breastfeeding is also real helpful. I'll put a link to those in the description below. If you use lanolin, make sure that it's lanolin that is intended for breastfeeding moms. That ensures that anything that's potentially harmful to your baby has been removed. Putting some peppermint water on your nipples is also something that provides relief. Peppermint is an analgesic and it's also an antibacterial. Now, the easiest way to do this is just to brew some plain peppermint tea and let it cool, and take some cotton balls and wet it with the peppermint tea, and then just blot that on the nipples and let it dry. Make sure you don't drink the peppermint tea because peppermint can actually decrease milk supply. Now, if anything touching your nipples makes them really uncomfortable, then using something like Medela soft shells can help keep the fabric off your nipples, and it just allows the air to circulate around them. Now, these are soft shells for inverted nipples, but the soft shells for sore nipples are very similar. So they look like this, and this is the other side. With the soft shells for sore nipples, this hole would be larger, and they come apart like that because sometimes you leak milk in there, and they give you these little sponges to put in there in case you do leak milk. You would just put that, center your nipple in the hole, and you would wear that inside your bra or tank top, and that will just keep the fabric from anything from your bra or shirt or whatever from touching your nipple. I'll put the link in the description for the soft shells for sore nipples. Now, nipple pain doesn't only occur in the early days of breastfeeding. There are various things that can create nipple pain at any time during your breastfeeding journey. Moms can get a yeast infection on their nipples. In a situation like that, the nipple can look bright pink. It might have a flaky appearance. It has a stinging, burning sensation. Now, there are a couple different ways that nipple thrush can be treated. You can apply gentian violet, which is an antibacterial dye that is available over the counter. Sometimes it's kept behind the counter, so you have to ask for it, but it does not require a prescription. I'm not going to leave a link to that because I really encourage you to talk to a lactation consultant before you try something like that. You could get a prescription for an ointment like nystatin or mycostatin, which is an antifungal ointment. And some moms will need to take a course of oral antifungals like diflucan or fluconazole. And that's something that you would want to talk to a lactation consultant and your healthcare provider about. Now, the thing to know about diflucan or fluconazole is that the dose that you take and the length of time you take it is different for a case of nipple thrush than for a vaginal yeast infection. So make sure that you get the right course of that medication if you end up taking it. Some women's nipple pain comes from vasospasms from a condition called Remedies syndrome. Now, women that have this, their hands and feet often get very uncomfortable when it gets cold, and the same thing can happen to their nipples. When the cold air hits it after the baby comes off, the nipples will actually change color. They will blanch out white and then get a purplish color before returning to their normal color. Having a heating pad nearby and putting that on it right away can help minimize the discomfort if you have Remedies syndrome. Some women also find that it helps if they grab the base of the nipple and pinch it up so that the blood flow doesn't leave the nipple, which is what causes that discomfort and those color changes. And you would just hold it for a few seconds, and then usually when you let go, it'll be okay. I've also had moms who got relief from acupuncture treatments for Remedies syndrome and the vasospasms that can happen from them. And in more severe cases, there's a prescription medication that can be used. And again, you would want to talk to a lactation consultant to figure out if that's the best course for you. The pain from vasospasms is described as stinging and burning, so it's very similar to what happens with a yeast infection. And there are cases where moms think they have a yeast infection when in fact it is a vasospasms. It's also possible to have both vasospasms and a yeast infection. And that's what makes it so important to work with a lactation consultant if you're having that kind of pain. The color change is really key to whether or not it's vasospasms versus a yeast infection. Another thing that causes nipple pain is called a bleb. It's kind of a funny name, right? It's also called a milk blister, and it's just a nipple pore that has been covered over with skin cells. There's an overgrowth of skin cells over the nipple pore, and the milk gets backed up, and this can be very painful. Now, the first thing I recommend if you have a bleb, if you notice that white spot on your nipple, is just to get like a warm, wet washcloth and put it on right before you feed your baby or you pump. And a lot of times that can soften it up so that the baby sucking will pull it off and pull the milk through. If that doesn't work, the other thing that I recommend is scrubbing your fingernails up really good, doing that warm soak with the washcloth and seeing if you can gently scrape it away with your fingernail. You can try this in the shower too, but you need to make sure that your fingernails are very, very clean, and afterwards putting a little antibiotic ointment on it can help avoid any kind of infection. Pumping is another thing that can result in sore nipples. If you have breast shields that don't fit the nipple properly, if they're too small or too large, when you're pumping, you want the nipple to be pulled through this tube area freely without rubbing on the sides at all. So it's important that you center it properly and that also you have the right fit. Just a little bit of your areola should be pulled into this tube area. So if the nipple is rubbing against the sides, either because it's not centered or it's not fit properly, that can cause nipple pain. Also, having too high of a suction setting on your pump can cause nipple pain. So what you want to do is you want to turn your pump up as high as is comfortable. And I always like to say that as high as is comfortable is not the same as high as you can tolerate it. So when you turn it up to the setting where you go, oh, that's a little too much, then just turn it back a little bit, and that's going to be your ideal setting. Now, some moms say they like the high settings because they can get more milk out. And one thing that can help with that is using the lactation massager. I'll put a link to that below. And that is something that can help increase your milk flow without cranking that suction up too high. Another thing that can help with pumping discomfort is to put a little bit of lanolin just right here on the inside where it bends. And that can really be a game changer in terms of making pumping more comfortable for your nipples. Now, it doesn't happen often, but I did have one mom who had an allergy to the plastic from the pump. Another cause of nipple pain can be skin disorders like psoriasis or eczema. So if you think that might be going on, then you should consult with a dermatologist. Some women experience sore nipples when their babies start solids, and if there's any food residue in their mouth, the mom might react to that. So if that's your situation, giving your baby some sips of water after solids, or better yet, it's best to breastfeed first and then give the solids after. Hormone levels can lead to sore nipples. So this happens sometimes to moms in the beginning, and the nipple pain doesn't go away after 2 weeks, and everything looks fine. And we find that for some moms, that's how their nipples respond to the elevated hormone levels. It usually gets better around 6 weeks when most of their hormone levels have returned to normal. Some moms, if they resume menstruating, will get sore nipples when they are premenstrual. And then getting pregnant when you're breastfeeding is another thing that can make your nipples sore, again, because of the hormone levels. If your baby is teething and does any biting, that's definitely going to make your nipples sore. And if you have a biter, it's just important to watch for the signs that your baby is done feeding and take her off as soon as you realize that she's finished. A lot of times babies will start to kind of move their head back and forth when they're really not sucking to get milk anymore, and preemptively getting in there and detaching them can help. If a baby is biting during breastfeeding, they are not sucking. They can't suck and bite at the same time. So they have to have their tongue out over their gum line, so it's not possible for them to actually be sucking and biting. So watch for the signs that your baby is done. Sometimes before, if they bite at the beginning, rubbing their gums can help make them feel better so they can get right to sucking at the breast. So those are the reasons that you might have sore nipples. I hope this was helpful, and if it was, I would just love it if you'd give me that thumbs up, and don't forget to hit subscribe and the notification bell, and I'll see you next time, Mama.